This essay is for educational purposes and not a substitute for professional medical advice. Always seek the advice of your physician with any medical questions. Never disregard professional medical advice because of something you have read here. While we strive to present accurate information, it is not a definitive guide. This essay provides a general overview of Guillain-Barré syndrome based on current knowledge and research. Consult healthcare providers for personalized advice and treatment plans. Guillain-Barré syndrome, or GBS, is a rare neurological disorder where the immune system attacks the peripheral nervous system. This disorder can cause a range of symptoms from mild weakness to severe paralysis and can affect both sensory and motor functions. The onset of symptoms is usually sudden and can progress rapidly. Patients may experience tingling sensations in their legs, which can spread to the upper body and arms. In severe cases, the muscles used for breathing can become so weak that the patient requires a ventilator. The exact cause of GBS is not fully understood, but it often follows a viral or bacterial infection. Common infections that precede GBS include respiratory infections and gastrointestinal infections. Some cases have also been linked to vaccinations, though this is extremely rare. Researchers believe that in GBS, the immune system mistakenly attacks the body's own nerves. This autoimmune response can damage the myelin sheath, which is the protective covering of the nerves, leading to nerve signal disruption. GBS is a rare condition affecting about 1 in 100,000 people annually. Despite its rarity, it is a serious condition that requires immediate medical attention. GBS can develop at any age, but it is more common in adults and older individuals. Men are slightly more likely to be affected than women. There is currently no cure for GBS, but several treatments can help manage the symptoms and improve outcomes. These treatments include intravenous immunoglobulin, IVG, and plasma exchange, plasmapheresis, which can help reduce the severity and duration of the illness. Rehabilitation is also a crucial part of the recovery process. Physical therapy can help patients regain strength and mobility, while occupational therapy can assist with daily activities and improve quality of life. The long-term outlook for GBS patients varies. While many people recover fully, some may experience lingering effects such as weakness, numbness, or fatigue. Early diagnosis and treatment are key to improving the chances of a full recovery. Support groups and resources are available for patients and their families to help them cope with the challenges of GBS. These resources can provide valuable information, emotional support, and practical advice. Understanding the basics of Guillain-Barré syndrome is the first step in addressing this condition effectively. By raising awareness and promoting early intervention, we can improve outcomes for those affected by this rare but serious disorder. The onset of Guillain-Barré syndrome can be sudden and frightening. Symptoms start with weakness and tingling in the extremities. This can quickly spread, potentially leading to paralysis. The speed of progression varies, sometimes evolving over hours or weeks. Muscle weakness can worsen and become extensive. Severe cases may affect breathing, requiring mechanical ventilation. Symptoms usually appear symmetrically on both sides of the body. Pain, often in the back and extremities, is significant for many. Early recognition leads to quicker diagnoses and more effective treatment. Diagnosing Guillain-Barré syndrome involves clinical evaluation and specific tests. A thorough physical examination and review of medical history are first steps. Lumbar puncture can reveal elevated protein levels in cerebrospinal fluid. Electromyography and nerve conduction studies measure electrical activity and nerve signal speed. These tests usually show slower or less responsive nerve signaling in GBS. Blood tests may rule out other causes for the symptoms. Treatment focuses on reducing the severity of the attack and supporting recovery. Common treatments include intravenous immunoglobulins, IVIG, and plasma exchange. IVIG involves administering antibodies to block harmful ones attacking the nerves. Plasma exchange removes harmful antibodies from the blood. Severe cases may require mechanical ventilation for breathing difficulties. Pain management and physical therapy are essential parts of treatment. Early treatment significantly affects the outcome, with most noticing improvement within weeks. Recovery from Guillain-Barré syndrome can be long but hopeful. Most individuals experience substantial recovery, though the timeline varies. Physical therapy helps strengthen muscles and improve coordination. Support from family, friends, and healthcare providers is crucial for emotional recovery. Despite potential long-term effects, many lead active, fulfilling lives. Raising awareness can foster better support systems and increase research funding. With ongoing research and support, the future for those affected looks increasingly optimistic.